We are going to continue the conversation and talk more about what we should know and steps to take to help control our blood sugar. Dr. Eno Newlin with Cone Health Community Health and Wellness Center is with us right now. All right, so to start, what are the health risks or the complications that could happen when blood sugar levels are unmanaged and we leave them unchecked?
When we have uncontrolled blood sugars, we can have what we call hyperglycemia, and we have complications of diabetes. And this range from the complications that affect the large vessels, like a heart attack or stroke. We call those cardiovascular disease. We could have renal failure leading to dialysis. We could have what is known as the microvascular complications, and these are complications where the vision is affected. So it's called diabetic retinopathy. We could have the nerves being affected, causing neuropathy, and people start to have numbness in their feet and they have difficulty with the sensation. Other complications include ulcers, and then people don't feel when they step on a nail, and that could develop into a sore. And in combination with the neuropathy, this could lead to amputations if they have underlying peripheral vascular disease. And that is another complication where there is occlusion or narrowing of the blood vessels that supply the extremities.
Okay, everything you've described are things that none of us want. So we want to make sure that we manage it, that we check it. Let's talk about some common mistakes people make when trying to control their blood sugar.
One of the major mistakes I've noticed my patients have making is in an attempt to control their blood sugar, they skip meals. And that's because they want to make their blood pressure controlled, the blood sugars controlled. So instead of skipping meals, what should happen is if you're noticing that your blood sugars are still running high, you want to get in touch with your PCP. You want to make them aware that whatever regimen you're using for managing your blood sugars is not controlling your blood sugars, and they need to adjust the dose of your medications rather than skipping meals in an attempt to control your diabetes.
Okay, so no skipping meals. There's other solutions instead. Okay, let's talk a little bit about some lifestyle changes that can have really big impacts on keeping our glucose or our sugar levels in check.
So when we say lifestyle changes, it's a big word that encompasses exercise, it encompasses diet, it encompasses weight loss. And so when we talk about exercise, we're talking about 150 minutes of moderate intensity exercise, like brisk walking, that would count. And when we talk about diet, we refer to what the American Diabetes Association looks at, the My Plate method, in which if you imagine you have a 9-inch plate and you're dividing that into 4 quadrants, one of the quadrants should have your carbohydrate, that's your starches. The other should be your protein, your lean protein. And then the other 2 quarters would have your fruits and your vegetables. And then we want to go easy on things like the fats, on the desserts. Those are things that, can make the blood sugar levels high. And then we look at weight loss. Losing about 10% of one's body weight can actually reverse pre-diabetes and change that to become normalcy. So smoking cessation. And so all of these things combined together is what we refer to as lifestyle changes. And these go hand in hand with medication in ensuring that the diabetes is well controlled.
Okay, we're going to talk a little bit more about that and maybe about what some hidden sugars are as well. That's coming up right after the break.